So just want to welcome everybody. Thank everybody for taking the time this morning. We have Dr. Kelly Ryan, who's the co-medical director of the Horsemen's Health Program in Maryland. We have Harrison Brown and Eric Vanderhelm from Headcheck Health. And they're just going to give an overview of the electronic jockey injury tracking system that has been in use in Maryland and is getting underway in Delaware. Give us an idea of how it works, how it benefits the riders. We've been focused on horse health and the strategic plan initiatives we've adopted, but this is, a logical next step because the healthier the riders are and the better they're riding, the safer the horses are going to be. So with that, I will turn it over to Dr. Ryan. If everybody could just, if you're not speaking, if you could go ahead and mute your mics. And Kelly, on to you.
Thank you so much. So, I'm glad that you said it and I didn't have to say it because people get tired of me saying it. But I do think that there is a huge lack of congruency and togetherness and consistency among our racetracks for our jockey health. I think that there's a lot of barriers. I personally have been trying to go around the country, talking about jockey concussion protocols and things like that. And I think that some of the racetracks understand that it's important, but there's been so many barriers to being able to actually manage these and to make a difference. I feel like sometimes that everyone seems interested, but that the barriers are so great that we really have not necessarily made as much headway as I wish that we would have. Of course, I have a different perspective because I come from other sports where there's much other resources, and the systems are different and the systems work against us. So one of the things that we're really trying to do is figure out how we can better manage the jockey health information in a more consistent way. So just a little bit about me. Like I said before, I come from a background of sports medicine. I'm a family medicine doctor, and then I was specially trained in sports medicine. I've had the opportunity to work with colleges, professional sports team, and of course I love working at the racetrack, but it is very different, very frustrating, and it's very difficult to continue to manage all of the jockeys' health needs. One of the things that I've done in the past couple years is I've actually been able to reach out to our international colleagues. So the British Horse Racing Authority and the Irish Turf Club, they do fantastic jobs of taking care of their jockeys and being able to document. They have a lot more resources, but I've really learned a lot from them. And so most of the stuff that I'm doing is not necessarily coming up with ideas myself, but it's not recreating the wheel. It's just taking what I've learned from other sports and from other countries and then just trying to figure out, what is keeping us from being able to do things like this and help improve the jockey health, because I do think that it's really important. I have sat through a lot of horse meetings, and I know that horse racing, yes, is a lot about horses, but there is a lot that we should be doing for our jockeys. So I've also had the opportunity to work with a lot of really amazing people, particularly the people in Maryland have given me a lot of support. I am an outsider coming in. So I definitely have a different perspective. And I know that there's a lot of things that you all have taught me, just some of the things that I took for granted, the way that I thought that things worked and the way that I thought that things would happen have been a rude awakening that people have been trying to do this for many years and have been unsuccessful. And so it's just a matter of trying to figure out how can we all work together and how can we find a system that can help to improve what we're all trying to do. So for today, we just kind of wanted to go over major barriers in creating a more unified protocol, particularly the concussion protocol, because that's what I've learned the most from, to be able to brainstorm together what ways that medical personnel can work cohesively and regulators to improve medical safety for jockeys at the tracks. Because there's a lot of things that, again, I want to do, or that the medical group wants to do that we just find we don't think about everything else, and it's been helpful to hear other things that have failed. To introduce a possible solution for improving medical coverage through record keeping and communication, which is the system called Headcheck Health that we've been working with, which has been fantastic, and that we hope will continue to flourish as a good relationship and be able to continue to change and adapt that program to what we really need in the horse racing industry, and then to propose the development of a committee to ensure the success of implementing such a system. So this meeting today is not just about, a EMR type of system or like an electronic system for jockey records and protocols, but really more a call for everyone to try to work together, because we need to figure out a better way to take care of our jockeys. And unfortunately, I've had a lot of instances where this has come to light. Maybe you haven't been quite as aware of it as I have, but it's something that kind of affects me almost on a daily basis. So some of the things that we'll talk about. So for the medical protocols, one of the problems is that there's not really much uniformity amongst the tracks. There's not very good communication. The medical care is variable. Some have doctors, some have nurse practitioners, some don't have barely anything. They just have EMS. A lot of the protocols are outdated, and it kind of goes against what we know from what we're learning in our medical field. So this is just an example. So jockey falls at track A. They're told that they have to be cleared by a physician. So then that jockey rides at track B, and after the race, then goes to the doctor's office to be cleared so that he can go back to his track and race. So there's no communication among the tracks, and it's actually very dangerous for jockeys to be riding without clearance. If that jockey couldn't ride at his track, then they shouldn't have been able to come ride at the other track. Concussion protocols is something I've been preaching for the past couple years. There's a couple different components to concussion protocols. There's education, there's baseline SCAT 5s, there's regulation, screening, management, clearance, and then also long-term concerns. But what I found is that it's not as easy as everyone thinks that it is. So for education, there's a problem with distribution, including language barriers. For baseline SCAT 5s, you don't want them to have to do it at every single racetrack. And so storage of those files is very important. Regulation is really important, but regulators can't really get on board if we don't really have a cohesive system in order to manage this. For screening, not all tracks have qualified medical coverage that can actually perform a good concussion evaluation, so that's a problem. For management, there's no a lot of times there's no resources for follow-up, like, so a jockey has a concussion, well, what do they do after that? Well, most people at the racetrack don't know. They kind of have to they kind of have to figure it out themselves. And for someone who actually has a concussion or a brain injury, it's very difficult. Clearance or, when can they actually go back, and you need a notification to make sure that everyone knows that they're able to go back. And then long-term consequences. I've heard so many jockeys or retired jockeys or riders that come back and that say, I have these symptoms. I got on a horse with my ears ringing. I just wish someone would have told me. And that seems kind of, almost like a no-brainer, but the thing is that there are a lot of barriers, and there is a lot of there's a lot of people who don't understand their medical care. And there's some people who legit didn't think that it was going to be a problem. So education and making sure that these riders are aware of the consequences is really important to me. So one of the things that I do want to emphasize is I do think that tracks should invest in the safety of the riders. There's a lot of racetracks that give me a lot of pushback and say, well, we don't have that. We don't have the funding. We don't have the money and all these other types of things. But there are some things that you can do that don't necessarily cost as much as you think. If we all just kind of work together and try to, figure out a way to do it, I just get really frustrated with everyone saying, well, we can't do that, we can't do that, we can't do that. Well, maybe we can't do it exactly that way, but let's all work together and figure out the best way that we can do it, because there does need to be change. So you need qualified medical professionals, you need them for emergent care, but then you also need someone to help follow them up. So if you still have a dermatologist working at your racetrack, well, you probably need to find somebody else. You should find qualified medical professionals who can handle these types of problems. For record keeping, we need somewhere to keep the physicals, so that way when they're unconscious and they can't speak for themselves, that we have access to the record. So I know exactly what injuries they've had in the past. This was something that happened with our racetrack very recently, and it was nice to be able to have those records to send to the hospital. injury reports. We want to keep track of how many injuries they've had, because just like we look at racehorses, you know, sometimes there are patterns, and so it's important to be able to have those injury reports and see whether or not there is some type of change that we could implement. And then the baseline concussion testing, the jockeys are definitely willing to be able to do this during their physical exam, unless it's the 50th time that they've had to do it. And so it just makes more sense that one person do it, and that you have that access to share to all the other states. The biggest problem with doing all of this is we don't really have anywhere to store the information, and we don't have a way to share it, because HIPAA is much harder in people than it is for horses, apparently. So, you know, it's just a great bear, and it's a huge barrier to us being able to share this information. One of the other things that everyone says, oh, it costs too much. And I will agree. I've looked at numerous EMR systems and ways to store information, and they are very pricey. Myself and the Jockeys Guild, along with Carl Matacola a couple years ago, started looking at multiple different programs that were out there that other sports are using, and it was very expensive. But luckily, we've been able to find Headcheck Health, which is more reasonably priced. And the great thing about them is that they're really willing to work with us so that we have exactly what we need. Headcheck Health was originally developed mostly for concussion management, but they've been kind enough to be working with us, so that way we also get a lot of the other things that we need for our industry. Athletic trainers are one thing that you may have heard me talk about before. Delaware actually is implementing an athletic trainer right now. They don't have a doctor on site at the time, but they do have an athletic trainer. And sometimes they are better trained for sports injuries than some of the just general practitioners who don't really have much knowledge in sports medicine, those types of things. And this is something fairly cheap that could be implemented at the racetracks to help with injury management and concussion follow-up and those types of things. I'm happy to talk to any racetrack about that. We are fortunate enough that we have sports medicine trained physicians at our racetrack, but Maryland mandates it, and I know that that's why we have it. But there are other ways of doing this. The other thing is that you could consider just making it part of licensing, and this was something we had talked about earlier, but we don't have to talk about that right now, because we found that this might not necessarily be the solution, but just something to keep in mind. One of the biggest problems is there's no communication of injuries. But one of the nice things about Headcheck Health is that this actually is a way that we can communicate about injuries. So in theory, if our tracks are lined up accordingly, if one of my core riders has a fall at another racetrack, then I'm notified. That's important to me because they see me the most, and they see our physicians the most, and they're going to come back to Maryland, and they're going to be seen by physicians in our area. So it's important, one, that I know if they had an injury or not. That way I can make sure that they're not racing at another racetrack and could potentially be putting, you know, themselves or someone else at danger. And then also, so that way I can help to facilitate their care, knowing that they're going to come back and that I should get them an appointment, you know, within a reasonable amount of time. So it's nice, rather than finding out over the internet, like, you know, on Facebook or Instagram or Twitter, that one of my jockeys had a fall. With this system, with Headcheck, we actually will get notified, which is really nice. There's a couple different levels of access. One of them includes the jockeys. So the jockey would actually have access to his or her own medical information on this app, and they can be able to see their riding status. There are certain forms that we're going to need them to have to sign in order for HIPAA compliance and those types of things. And they can do that all through the comfort of their phone, which they always have, and they're always on. They can actually view their physical. So if they lose their physical card, it doesn't matter. They'll have access to their entire physical, which will be nice. So it won't just be just a card. It'll actually have their information that they can share with the other racetracks. And then if they need to, they can also update and view their injury recovery progress. If they have a fall and they go to a hospital, they would actually be able to scan some of their documents up into their chart, so that way we have that on their records. The clerk of scales will have access, which would be nice. They'll have a remove of riders list, and then they'll also have an alert if they have something, like if, you know, there's a new jockey that comes into the jocks room, and, you know, Frank is our is our clerk of scales. You know, if he has an alert that says, hey, so and so is a new rider, he needs a physical, then he knows that that rider needs to come see me before he can ride, or whether or not he still needs to have his baseline concussion testing done. The stewards will have access. We limit the access because not everyone needs to know everything about everybody, and that's one of the biggest holdups of you know, being able to share all this information. I don't want everyone's information shared to everyone, so you just really, it's like, who needs to know what. So for the stewards specifically, they'll be able to know what jockeys are injured, what jockeys need follow-up, and they'll be able to keep an eye out if they have any riders that are there that shouldn't necessarily be riding. They also will have the ability to flag a rider if they see them have a fall, and there might not necessarily be the same medical care there. We've designed this in the hopes that it will be able to meet the needs of different types of tracks, whether you have a physician, whether you have an athletic trainer, whether you have EMS, or you know, whether you're not even that fortunate to have most of that. EMS will have their own access because EMS is allowed to do certain exams. They're not necessarily allowed to do other exams in certain states. So we have that specifically for them. So again, it's only what they need to do. But they will be able to report an injury incident. This will also be important for us, like in Maryland, we don't have, we're not there in the mornings, but there's a lot of injuries that happen in the morning. So EMS will actually be able to alert us that there was a fall from one of our riders in the morning. So that way we know when we go in that we have to check them before they can ride. The athletic trainer, again, they have a little bit more accessibility because they are allowed to do concussion evaluations. And so they can do the baseline concussion testing. They can evaluate the jockeys for the injury. And then if they need any help, they have an affiliated physician that they work with. And that's a relationship between them, you know, to work out. But that's how they will possibly be able to clear a jockey. But they have their own accessibility. And then, of course, the medical director, physician, you know, we have access to their emergency contact information if they can't speak for themselves. We have a removed from riding list. We have injury incident reports. We're able to do the concussion testing. We're able to monitor injury progress. I can upload notes if they go to other outside physicians. If they're doing better and I follow up with them, I'm allowed, this is actually a place for me to be able to document that. I'm able to do their concussion protocol progress, which is also built into the system of Headcheck, which is really nice. And then again, I'll be able to view their previous medical information, which is really important. And then the administrator just has access to add or remove individuals as needed. So for the timeline of Headcheck, we kind of started talking to Headcheck back in the fall of 2019. Robert Colton was a huge piece of this and has been very helpful and has really been doing a lot of work with us on this. He's very passionate about what he does, and he really wants to see this through. He was the one who stumbled upon Headcheck Health, and you know, again, it wasn't initially what we had really thought of when we were thinking about what do we need in order to make this program successful. But again, they've been so wonderful about being adaptive and hearing our needs and meeting us where we are. So it's really been a great relationship. And then so we started working with them, doing some development, and then the Maryland Commission, the Maryland Jockey Club, along with the MedStar Horsemen's Health Program, we actually started implementing Headcheck early at the beginning of this year. And then COVID hit, so we weren't really using it as much, but we've been just kind of working through some of the system bugs. We've been trying to get our core riders in. We've been using it to report our injuries. We've been training our staff. And then just recently, Delaware began using the same process during their racing season. Now we're really working on our legal issues around sharing the information among the track. We've been working out some of the computer errors that comes with development of any new system to ensure the functionality. So in the future, one of the things that we look for specifically with the use of Headcheck Health is, you know, COVID has been huge in terms of learning, particularly for medical personnel. My practice changed dramatically when I wasn't able to actually see patients. But one of the things that we'd already been considering was, what about those really small tracks that don't necessarily have access to a sports medicine specialist or to a concussion specialist, right? What happens to them? What happens when there's only one doctor, like in the entire, you know, city that small little town that they have, right? And they don't have access to it. Well, telehealth is actually a potential answer to a lot of these problems, right? What if you could telehealth a physician right after a rider falls, and you can do a good evaluation over the computer to say, hey, do I suspect that this patient has a concussion or do I not, right? What a wonderful system that would be. Except for it didn't matter if we had that system because we didn't have anywhere to store the information or anywhere to document this. So that really was never going to happen until we had a system where we could put that information. So Headcheck Health and having a system like this really opens up those possibilities for us to do these types of consultations if needed at some point. And specifically for our MedStar Health, we're not really doing our e-visits just yet, but then COVID hit and they got all of their stuff together, and it's been a smooth running program since. And we've managed a lot of patients over the internet and over the computers, and helping to direct them. So this certainly is a possibility in the future, to help with those smaller tracks that don't really have as much resources. We will be able to enter in the information for safety helmets and vests that are worn, which of course is important for research and for further management and development of these types of safety protocols, and protective equipment, because right, there is a need for a lot of this, but we don't have the information. We don't know what the riders are using. Ireland does a really good job of that, but that's something that we certainly could improve on. But Headcheck Health has been able to put that information, has been able to put an area where we can enter in that information so we can store that type of information. We will be able to do custom data analysis, right? So how many injuries are happening near the gate, how many injuries are happening in the post parade. We'll be able to take a look at all that information if all of us use the same injury data form. And then, so also the same data forms, it's really difficult to have to pull all of them and then enter in and then do by hand, Excel spreadsheets, all this type of information. I just did that recently. We're going to be publishing a report on our injury data, but this would have made it much easier how we had that at that time. And then the other thing that you could think about is maybe potentially utilizing the ineligible status for those who may be on a COVID quarantine or have recently traveled, right? You could easily add that to the ineligible area, and there's a lot of different things that you could do, but these are all just different possibilities that we could potentially talk about in the future. Again, research, I am very much a big advocate for research because I think that we learn a lot from it. Are there any trends? Or there's something else that we can do to make our racetrack safer? And then, what do we look like for the road ahead? So one is we really need to organize a group to regulate the onboard tracks. So if in the future, what we're looking at is getting other racetracks to work with us on this Headcheck Health. And we want our racetracks, particularly in the Mid-Atlantic, to be on it because our riders are the ones that are going up and down, the United States. So we want other racetracks to be on board because it doesn't make any sense for just one racetrack to have it, right? I mean, it helps, but it works if other racetracks are on board. But we really want to make sure that it's a smooth process. If someone comes on board, we want to make sure that they have a good, concussion protocol, and we can work along with them. Those types of things. And we want to work with both regulators and medical personnel. And then of course the Headcheck Health group so that they can help to understand what's important to us and what we need changed. And again, medical professional regulators, Headcheck developers. We also need a lot of legal help because this is a very big legal undertaking to be able to share that information. But I think overall it definitely will be able to improve the safety at our racetracks. And then of course, just working together to further identify needs, as they come along. Sometimes you think that things are working well, and then someone points out that your system is not necessarily as good as you think that it is, and so you work on improving it. And with that, I'm going to turn it over to Eric.
Thanks so much, Dr. Ryan. Can everyone see my screen here? The Headcheck Pro?
Yeah.
Okay, perfect. Yeah, so thanks to Andy for setting this up and in advance for the continued support she's going to give to us. Thanks to Dr. Ryan for the incredible amount of time and effort that she's put into working with us and working with the system and the trust that she's put in us. I'm Eric Vanderhelm. I'm an account manager here with Headcheck Health. I've been here for almost 2 years now, and my main focuses have been higher education, private schools, and then lately the horse racing industry in the United States. I was born in Pennsylvania. I grew up in Ontario, and I went to Queen's University for psychology and neuroscience. And I'd say the reason I work for Headcheck is I'm passionate about keeping athletes safe from head injuries. And that's because I've known several people, including myself, that have gone through it. The reason I'm here today is because regardless of what your role is, whether you're a regulator, you represent jockeys, you are a jockey, you own or you operate a track, everyone's affected, whether that's financially, physically, or emotionally by concussions. And, it's serious when something happens. And it's a disaster when those involved aren't prepared or they're unable to manage it properly. So the ask that we have for all of you today is to help us become the leaders in your industry. We've made the Headcheck system work for other sports, and we're asking for you to help us do it for you in your industry. And one of the first steps to doing that would be to join this committee to help us make sure that you're engaged and involved in this process. We know that this has been attempted before, we know that and we know that it wasn't necessarily what you wanted it to be. And we want this to be the last time that you guys attempt to do this. So let's get a group of smart people, leaders in the industry together, and let's make it happen. Headcheck CEO Harrison Brown is also on the call here today, and I'd just like him to quickly introduce himself and then just give a bit of a background on the company before I get into the presentation.
Thanks, Eric. Yeah, a little bit of background behind us. We've been around since 2013. Our company was spun out of a concussion research lab. And I guess what makes us different is we're not trying to force you guys to do something different. I think the thing that's really worked for us has been really trying to find people within organizations to tell us how it needs to work. And that's a little bit different. In the past, it was, hey, here's what a concussion protocol should be. Here's who should be doing stuff. Can you guys fit within that black box? And the approach that we've taken with Dr. Ryan and really with all of our clients has been kind of flipping it on the head and saying, what do you guys actually need? What are your protocols? You guys have smart people. You guys have way more knowledge than us, and let's just allow us to make it easy for you. And a little bit of background, we do work with about 800 organizations across North America at this point, everywhere from kids sports, so minor youth, football, hockey, lacrosse, things like that. But we do go all the way up to the highest levels as well. So things that you guys would know about would be Major League Soccer, Olympic programs, Division I university programs, and really those elite programs are kind of where we get a lot of our knowledge from. And so as you can see on the screen here where it says Headcheck Pro, that is the system that we want to implement for you guys. So that's our highest level of service. It's our highest level of platform. It's used by the top people in the industry around the world. And Eric's going to kind of walk us through that at the moment.
Thanks, Harrison. So since Dr. Ryan's spoken already about the challenges that you're facing and about concussions, I'm going to go through the intro slides pretty quickly. I'll go into a little bit of detail on how the system actually works and what it looks like with some screenshots and how it's going to help to solve those important problems in the industry. So this slide, basically lots of concussions. One of the main reasons why Headcheck exists is because roughly half of concussions, wherever you are not reported or not detected. And when that doesn't happen, then the athletes don't get the care that they need, and then it can lead to problems for everybody. These are just some stats on just equestrian in general. About 7% of falls result in concussions, which leaves lots of room for error there. There's a lot of competing interests at a track. Different people want different things, and everybody wants to win. And that can result in lawsuits, implications for your insurance, but most importantly, jockeys or exercise riders suffering lifelong consequences from, depression, or more seriously, when you look at this slide here, for those of you that don't know what second impact syndrome is, it's one of the main problems that Headcheck solves is the completely preventable problem where a athlete suffers a second concussion before they've recovered from their first one. And when this happens, it can lead to some really horrible lifelong complications, and it can even be fatal. And another important point is that, not only is it the right thing to do to ensure that the jockeys are recovering before they return to ride, according to this study and some other studies, it's actually the fastest way to ensure that they can get back to riding safely. So being able to immediately pull that rider and get them assessed before them going out and riding again and putting themselves at risk is the fastest way to get them back on the horse, which is going to be more racing overall for them and less problems for everybody. So as Dr. Ryan was mentioning, a lot of tracks are starting to, and Harrison was mentioning, a lot of tracks are starting to get protocols in place. They're starting to get some medical staff. They're doing testing. They've got some other tools. Really what Headcheck is kind of putting that last puzzle piece in there, and we're kind of like the glue that holds all of that together, right? Because if you have baseline tests, but you can't share them between tracks, or you have medical records, but they're not accessible, or you have a protocol, but you don't know if it's being followed, this is where Headcheck comes in to help you track eligibility for the jockeys and give people access to information that they need, but don't give them access to information that they don't need. Without a comprehensive system, you've got all sorts of different people, medical, non-medical, that have different parts that they need to play in the concussion protocol. And without a system like Headcheck, you often have people not confident that they can perform their part in that process. So this is where we come in. For non-medical staff, we have, the big thing here is that live dashboard of the ineligible jockeys. So it shows them any jockey that might have fallen or a jockey that has been marked as ineligible. So when they come in the morning, they can look at the list of the jockeys that are racing that day. They can look at the live dashboard, which I'll show you in a minute here. And they can see if any of those jockeys are on that list, and then they can follow up with it a lot quicker than they would have been able to otherwise, or potentially would have had somebody calling their cell phone or texting them about it. This is just a really comprehensive way of sharing that information about the eligibility of the jockey without sharing their health information. For some tracks, they might want to have, depending on their medical personnel, they may want to have non-medical people act as a sort of concussion spotter. What the non-medical access of Headcheck allows them to do for the horse racing specific software we've set up is that they can mark a jockey as being follow-up or fall, basically. So they're not saying that they're not diagnosing that rider. They're just saying that they saw that there was a fall, and they want to make sure it's marked in the system that the athlete jockey needs to be followed up with. It also allows them to, for the non-medical personnel, to upload clearance notes, right? So a jockey comes in, and depending who they give that clearance note to, they can take a look at the clearance note, verify it, approve it, and they can take a picture of it and upload it to the jockey's profile. And then they can go and change the health status of that jockey as a result. And that changes it for all the tracks. So improving that communication within the track and between the tracks. For medical personnel, there's a whole ton of functionality here that Kelly went through a little bit already. They're given access to a full digitized SCAT5 module with some other tests as well. I think Dr. Ryan wanted us to add in a PHQ-9, which is a depression inventory. So we added in a little test onto the system as well. And we're always keeping up with the latest research and based on the evidence, making those available for our customers as we go. So as you work with Headcheck over time, as a lot of our clients do, maybe we'll start here with software customization, as we've been doing with the jockeys, and then we're figuring out their user access, figuring out who's going to do what part, figure out how to implement and use the program. You get feedback on how it worked. You alter your policy a little bit. We adjust our software a little bit. We keep going. And then as you go, over multiple years, over periods of time, you're really moving that needle on athlete safety. So we're not saying that Headcheck's going to come in and you're going to have 100% compliance right away. But we are saying that you're going to go from, I have no idea, or maybe 20% or 40%, to knowing exactly where you're at with compliance to the protocol and athlete safety, and being able to move that dial every year. Headcheck also does the bulk of the heavy lifting when it comes to signing forms, which Dr. Ryan did go through already really quickly. You can, as a jockey or a user in the system, excuse me, you can access educational materials, policy, consent forms, waivers. You can view videos, education. This really helps with that dissemination of concussion education for people. And you can use it for a lot of different things. Just want to quickly go through what we're not. I think we've mentioned this already, but we're not trying to change what you're doing. We're not a specific test that we're claiming is a way for non-medical professionals to be able to diagnose concussions. We're not a testing company, right? So we didn't create this amazing test. And we're not obviously a replacement for clinics or medical professionals, given that we're working with folks like Dr. Ryan and with the athletic trainers over in Delaware. So I'm going to go through quickly what a few of the key functionality components of the software are on some screenshots here. This is what the dashboard looks like for example, for a steward. So all they need to know is that these athletes are on the ineligible list or that they need to be followed up with. But if you go and you take a look at, so if you see here, this is Bill Schumacher, famous jockey, as follow-up. If they clicked on Bill Schumacher there's no way for them to actually access any of the information from this athlete. They can see that he's on this list here, but when they go in to take a look at the information, they won't have access to it, which is really important for maintaining HIPAA compliance. However, if you are a medical staff, you'll see this little line under here. You'll see that the test actually resulted in a suspected concussion here. You'll be able to click on it and actually access the SCAT-5 concussion test that was done in that situation, given that you need to use it for their treatment. This is the medical staff dashboard. So we've got not only the follow-up and ineligible columns here, we have suspected and diagnosed concussions over here, revealing a little, more medical information than just these health statuses, any recent activity that they might want to quickly access, anybody that's missing a physical note or that needs a baseline test. These are modules that we can add in to the dashboard of the user, depending on what functionality they need to see. And we can lock out from the back end whether or not they can see, whether or not they can drill down and actually look at the information from the dashboard. This is the accident report. So basically we took this, Maryland first report of accident, that you would normally fill out on a piece of paper. And then if you ever wanted to do any research on it or anything like that, you'd have to scan it, maybe put it up into the computer, fill it out onto an Excel spreadsheet. With this, you're putting it all in digitally. It's recording the time that you put it in, and you're going to be able to get some really good data over time. And it's much easier than carrying around a binder with a bunch of pieces of paper in it to do these accident reports. You can just do them right on your phone. This is what it looks like to upload a clearance note. So whether you're a non-medical or a medical person, you can go in here and you put down when the injury was. It's going to automatically timestamp the time that you put in this clearance note. You can, if you're on your phone, there will be a little camera symbol right here. So you'll be able to take a picture of the note and upload it, or you can pull a note from the computer. And this is really important because, as Dr. Ryan was mentioning earlier, jockeys going and racing at a different track and then getting cleared. If you're using a system like Headcheck, you can actually go back and take a look at if the concussion was, or the injury was handled properly or not, based on the timestamps that are put in, and the user that put in the information, you'll be able to see who put that information into the system. This is just a screenshot of the built-in SCAT-5 test. So the SCAT-5, our clients, the medical, the athletic trainers and doctors that use our system, they love it. It's got built-in stopwatches, word scramblers. We customized the Maddox questionnaire, which is one of the tests to reflect the horse racing industry a little better. So asking them questions, instead of asking what period they're in, it's asking them what race number were you, things like that. This is just another admin view here. So in this view, you're drilling down into one racetrack, and you're taking a look at their health statuses over here in this column, whether or not they have a baseline, their latest post-injury test. This is where you would, if you needed to add a jockey because they weren't in the system yet, you're doing it there. And then here's a screenshot of the e-signature module that we have. So this is what it looks like when you log in as a jockey. You can go and take a look at your tests, take a look at your forms to see which ones you need to sign, and then you can sign right here in the system after viewing the PDF. Just kind of put your signature in here, and it's going to keep track of this for you. And then on the other side of this, as an administrator, whoever's managing the process of whether this is a part of licensing or somebody at the track is managing this process, they're going to be able to have a list of which athletes have completed their required forms and which athletes haven't. And there'll be a little button there that will just say send reminder email. and they can go and just send a reminder email with one click of their mouse, as long as all the jockeys have their emails in the system, which they have to, and it'll go and send them an email to remind them to complete the forms and sign in. As Harrison was mentioning, we do work with some high up leagues, Major League Soccer, the Canadian Football League, and then across Canada, all 10 Junior A hockey leagues are using Headcheck. And like you mentioned, the reason that we're able to win against our competitors in this space is that we're the most flexible system and we're the most powerful system. And I think that we've shown that up to this point by working with Dr. Ryan and with Robert Colton, and we're excited to continue to move forward and working with you. So with that said, I'd like to leave lots of time for questions for everybody and some discussion here.
Okay, thank you, Eric and Kelly. I think that's really good stuff. We want to open the floor to some questions. So if anybody has a question, can you raise your hand? Use the little raise your hand button so that we can open your mic if need be, or recognize you to ask a question. And then, as was mentioned by both Eric and Kelly, we are going to be looking to put together a committee. We need to identify a lot of different aspects of this program. How is it going to be put in place? Who's going to be responsible? Who are the medical professionals at each racetrack? That would be the point people, the regulators, what's their involvement going to be, the racetracks, how does it get funded? There's a lot of questions to be answered. I think Maryland and Delaware have already addressed a lot of them, so they can inform us as to how it's working there. But even from a standpoint from the horsemen's, one thing we haven't talked about a lot is that the system works for the exercise riders as well as the jockeys. And of course, workman's comp is a huge issue right now. And this is a system that, if it was put into place, could, streamline the care, improve the care for exercise riders that get injured, and, potentially could be have an impact on the cost of work comp. So, even the horsemen's groups should have a seat at the table to see how this might work for everyone. So with that, is there anybody that has any questions?
Andy, just to quickly address that, so we've gone through, obviously with Maryland and Delaware, working with them already, but the structure that we've decided on in terms of the pricing and in terms of the of working with the exercise riders is we don't feel that it's necessary to treat the exercise riders any differently than the jockeys. And so the exercise riders are included in the cost of the program, and the sort of pricing structure that we decided on for the system was to be a per race day model to accommodate for the size of the different tracks. So we have basically a $40 per race day model for the track with a minimum of 1,000 and then a maximum of 6,000. And then exercise riders are included in that. So any jockeys or exercise riders that need to be in the system would be included either way. If you don't want to include them, that's fine, but they're included either way.
Okay, that's great. Ed Martin, you have a question? I think you just have to unmute. There you go.
Yep, I got it. Are you envisioning participation to be voluntary, or a requirement of riding at a track, or a requirement of riding in a jurisdiction?
I have a feeling, yeah, I think maybe I can answer that. I think that's one of the questions the committee has to look at. Is it, is the racetrack and the clerk of scales going to take responsibility for saying, okay, you don't ride at our track? Or, will we need regulation to enforce it? I think that's a good question. Do you have a thought one way or another?
I don't. The only thing I think of is I think this has usage nationally, not just regionally, especially since a lot of the riders are, will be coming in and out of states that are not necessarily in the Mid-Atlantic, at least some of the higher end riders. So I just, it's definitely looks like a very fascinating system you got.
So, Ed, thank you so much. And, people such as yourself are going to be huge, to support it. And we're going to need that. Eventually, we do envision, of course, we would envision this to be used among, across the entire country. Andy has been so helpful with at least getting this meeting started, I personally wanted to work with Eric and with Headcheck to try to figure it out from a medical standpoint to make it functional before we don't want a system to fail. I want this to be, I want this to be successful. And one of the problems with the Jockey Health Information System, I mean, the ideas were right there when the Jockeys Guild did that, when they created it. The problem is that in order to get around HIPAA, the jockeys were responsible for entering in their own information. And when the Kentucky study was going on, what was happening was the athletic trainer that was working with them would actually had to do so much work to help them log in, to enter in their information. And we can't rely on them to put in their own medical information. And as a medical personnel, like, I care differently about different things. So that's the reason that it wasn't necessarily really successful, but luckily Headcheck brings that HIPAA policy, already has HIPAA protocols and covers that. And that was one of our biggest concerns with this type of thing. But yes, ultimately we would like for it to be national. We need your support, but right now we're just trying to make sure that the functionality works amongst 2 tracks for communication, and then hopefully open it up to a little bit of a larger region. And then ultimately the goal would be, yes, across the United States.
So from my perspective, the envision that I have moving forward this would be to, I've heard that this Mid-Atlantic group is a very collaborative group and very forward looking, and I think it would be great to get this machine kind of working, well oiled, working in the Mid-Atlantic. But the other aspect of that is that there is a huge benefit for the tracks to sign on to the system. I would hope that the tracks would be able to see that benefit and come on board without having to be told to do it, because there are risks associated with your jockey or another jockey riding at the track when you're not aware of the status of the jockey. So there's legal and insurance and workman's comp and all these other benefits to using the system. So I think whether it's voluntary or not, I think there is a huge benefit to the tracks signing up for a system like this, especially considering it is for a reasonable cost per year.
Okay.
Ed, sorry, Andy, Ed, the experience here with the riders, getting them to buy into the program has been very successful. It's because it's been a cooperative effort between the tracks and the horsemen. That's been key. The jockeys at first were kind of standoffish, but the more benefit they saw from it, the more they bought into it, and they look forward to complying with it. Number one. Number two, I think most racing jurisdictions require the riders to have an annual physical. That's when this process begins, and when they need to sign off on the waivers that are contained in the program to give access to the information in multiple jurisdictions. So forcing them to do it, I think that's kind of a strong word. I think by including them into it is probably more preferable. I don't think you're going to see a lot of pushback from them. Certainly we have not here, and Delaware has not, as far as the riders are concerned. But the primary driver here is to make sure you have cooperation amongst the horsemen, and the racetracks want to do it. It benefits them as well.
Yeah, the jockeys have been really open to it. A lot of them are really interested in it. Again, they hate those stupid physical cards that they always carry around that they always lose anyways, because half of them don't even have wallets anymore. So they are interested in it. And they've been pretty open to it. And, I guess it wasn't last year, but the year before, they have all been coming together saying that they do want concussion protocols. They do feel like it's important, particularly some of them who have recently suffered from head injuries find it to be extremely important. They have been pushing for it and those types of things, even without any other involvement from anybody else. But again, one of the biggest barriers is just how to work it out amongst the tracks. So this does offer a really good solution to a big component of our problems with expanding our concussion protocols.
Okay, does anybody else have any comments or questions? So I will be sending out an email inviting and encouraging people to volunteer for our committee, and I'll probably reaching out to tap a few people to ask them to be part of the committee. We also recorded this, so I'll make sure to share this with everybody who wasn't able to participate today. And if anybody has any follow-up thoughts, feel free to reach out to me or to Dr. Ryan or to Eric and Harrison to share your thoughts. And, we'll just see if we can move this down the road. Okay.
Thanks so much, Andy.
Yeah, thank you. Thank you, everybody, for
Wait,
participating.
I have one more question.
Oh, go for it.
So, I mean, so what would be the next step now? I mean, is there anybody on this call that's particularly interested in helping us, or?
Kelly, I'm going to go ahead and, I'll reach out to the whole group and get some feedback from them.
Okay.
And get, and we'll put the committee together and work from there. So I think that's the next step, is to put this committee together and to look at all the different questions that came up and how it's been handled in Maryland and Delaware, and then just move it from there.
Okay, great. Thank you.
Okay. Thank you, everybody.
Thank you.
Thanks,
Stay
folks.
safe.